members.
Meeting
All
in
right.
progress. So now,
Gonna go.
presenters laptop test ECNS meeting November 19, 2020. Clerk's laptop ECNS November 19th. Sound test. And pre. And now clerk's laptop sound check. ECNS November 19, 2020. Presenter's laptop sound check. ECNS committee November 19th, 2020. And
Give me 1 second.
presenter's lap. Is that me? Yep. Presenter's laptop sound check. Laptop. Clerk's laptop sound check. Clerk's laptop.
Okay, I would like to call the meeting to order. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. Other individuals and media may also be audible and or visually recording the meeting. All electronic devices are to be switched to a non-audible function during the committee meeting. Members are reminded of the 5-minute limit, which will be adhered to during this meeting. Members can submit another request to speak if they require at that time. I will begin the roll call. Councillor Clark, he had another meeting, so he can't be here. Councillor Jackson.
Ward 6 has joined you, Madam Chair.
I'm glad you're here. Councillor Marula.
Present, Madam Chair.
Councillor Nan.
Good afternoon, present.
Thank you. And Councillor Whitehead. He's not present. Okay, approval of the agenda. Madam Clerk, are there any changes to the agenda?
Yes, Madam Chair, there are changes to the agenda. We have 3 delegations for today. Item 8.1 is Angela Pugliese, respecting the crisis with supportive housing for those with disabilities. We have item 8.2, Robert Scott Innes, respecting an update on the progress of an affordable low-cost housing program. And we have 8.3 with Francis Lau from the Master Medical School Day of Action Committee, respecting homelessness in Hamilton. We also have discussion item 10.3, Mikasa Lodge Redevelopment Project, HSC 20050, Ward 7 has been withdrawn from the agenda today. And for item 10.4, not a change to the agenda specifically, but report HSC 20053, respecting federal reaching home funding allocations citywide, was revised to reflect new information. The revised report has been published on the agenda website.
Thank you. And may I have a mover and a seconder to approve the agenda as amended? Councillor Marula and Councillor Nan. Yes, I think I have Councillor Tom Jackson.
Yes, Madam Chair. Elsie Bates, I was just looking at my Samsung, so I apologize. Did you also include in the revisions my motion on 10.1? Through you, Madam Chair, please. Under item 11, sorry, under 11.
I'm sorry, I was muted there for a second. I have not included that on the agenda, but you will just bring that to the floor.
Okay.
Raise that on the floor, okay?
Oh, that's fine then, Madam Chair. I just didn't want to lose sight of it. Sorry, Madam Chair. Thank you.
Okay, so that's clear. Thank you. Okay, so is there any discussion on the agenda as amended? I see none. Okay, we will require an e-vote. Please indicate your vote. Okay, and the motion was carried. Okay, declaration of interest. Is there any declaration of interest? I see none. Okay, let's move on. Approval of the minutes, previous minute, 4.1. May I have a mover and a second to approve the minutes of November 5th, 2020 meeting? Councillor Jackson and Councillor Marula, thank you. Is there any discussion on the approval of the minutes? I see none. And we'll go on. We'll have a e-vote, please. Thank you, and it was passed. Okay, we're going to move on to consent amendment 7.1, expanding housing and support for women, non-binary, and transgender community subcommittee, report 20-002. May I please have a mover and a seconder to put the item 7.1 on the floor? Councillor Nan and Councillor Jackson. Thank you. Is there any question? Councillor Nan, did you want to speak? No. Okay. I'll move on.
I can.
Yes?
I can.
Okay. Is- Go ahead.
Hi, thank you through the chair. Sorry, having a bit of a tech issue in this moment. I appreciate the moment to just speak quickly. This committee is going to be meeting again shortly, given the current state of affairs as it relates to housing and homelessness and the need to address the gap in our shelter system for those who are women, identify as non-binary or transgender. And so just an update to the community that the committee met. There is going to be another meeting coming up this in December, and it is the hope and intention of the subcommittee to be bringing forward recommendations in relation to the funds that have been recently announced by the province. Thank you.
Thank you. Okay, we will have an e-vote to approve the report. So please indicate as soon as you get your vote. It is. Thank you. Okay, and it passed. Okay, we're going on to public hearings delegation. All right, Angela Pugliese, respecting the crisis with supportive housing of those without disability. So I would like to call upon Angela, respecting the crisis with supported housing for those with disability. Angela, please turn on your camera, unmute your microphone, and you have 5 minutes.
First of all, I'd like to apologize, but I had difficulties getting onto the web today.
Okay, understandable.
So unfortunately, I'm on a cell phone.
Okay,
Thank you for giving me the opportunity to speak in front of the Emergency Committee in regards to the crisis in supportive housing for people with disabilities. My name is Angela Pugliese. I'm a parent to an autistic son who has turned 19, who requires 24/7 care, dealing with all the challenges and struggles on a day-to-day basis with the limited resources available once they turn 18. I'm here today to speak on the crisis facing so many with disabilities. Supportive housing. It is estimated that the wait list for supportive housing is close to 26 years. I've written to all levels of government in regards to this. Excuse me. A house is a base from which we have the security to build our lives as we choose.
take your time.
We should have the ability to choose where to live, whom to see, and how to behave in our home. In our home, we should have the privacy to reflect and relax in peace. We should have the autonomy to decorate and maintain our home as we see fit. Our home is the focus of our social network. These are autonomy, essential privacies of mental health and well-being. They should be seen as necessary components of housing programs, not as privileges to which people graduate. Housing problems have led to worse health outcomes for people with disabilities, mental illness. Shortfalls in supportive housing in Ontario are linked to higher service, more hospitalization, adverse health outcomes, more homelessness, and lower life expectancy. Study after study has shown that supportive housing not only resolves homelessness and increases housing stability, but also improves health and lowers public costs by reducing the use of publicly funded crisis service, including shelters, hospitals, police resources, and psychiatric centers. When factoring the cost of housing, eliminating outliers, they found that supportive housing reduced each person's public costs approximately by $1,145 per year. As a parent to a son with a disability, like so many, my biggest fear is that I might be forced to put my son to a psychiatric hospital before my son will be placed in supportive housing. It's humane what is happening in psychiatric hospitals. They are locked in rooms, and if their behaviors escalate, restraints are used. This is a reality for so many innocent young adults who strictly have autism. We are in desperate need of more treatment centers in place rather than having no alternative to put them into a psychiatric hospital. I'm asking for the City of Hamilton to recognize this as a crisis. We are asking for the City of Hamilton to write to the Ministry of Community and Social Services, Todd Smith, and Premier Ford to address this crisis. We are in desperate need of more treatment centers for those with developmental disabilities, and we are in need of more supportive housing to meet their needs. Thank you for giving me the opportunity to speak in front of the Emergency Committee on this crisis. And I apologize about the coughing.
Well, you don't need to apologize. Angela, thank you. You're a great advocate for not only for your family situation, but for all with
Thank
those
you.
with disabilities. So thank you for coming. I'm going to see if there's any of our staff, of our counselors that need to ask you questions. First of all, is Councilor Marula. Councilor Marula?
Yes, thank you, Madam Chair. Just through you to Angela, many thanks for appearing here today and presenting your case, which I believe is a very sound argument and something that needs to be addressed. I'm wondering, do you have your presentation in writing? And if so, could you, if staff has a copy of that, could we forward that to staff for a review on every point that you've made so that we can have an understanding of what we can do as a committee to advocate on your behalf? So at the appropriate time, I'd like to move that and have staff just assess and determine what referrals are necessary for action accordingly. And I appreciate your time. And again, Angela, you did a great job. Thanks very much.
Thank you. Thank you, Councilor. Councilor Jackson.
Thanks, Madam Chair. And similarly, I will support and second Councillor Marula's motion. Angela, I just want to say thank you for the courage of coming forward today, speaking on behalf of your son, and I'm sure on behalf of thousands of families with similar needs and in similar situations. And like Councillor Marula, if you could maybe after this meeting help our clerk Tamara Bates with the language of the resolution you'd like to hopefully see this committee and council forward to the Premier and the Minister, I'd be happy to support that as well. Thank you, Madam Chair.
Thank you, Councilor Jackson. Councilor Nan.
Thank you, through the chair. Thank you, Angela, for coming in and joining us virtually to delegate today to raise the importance of supportive housing. And absolutely, many demographics here in the city are facing the need for increased resources, and specifically the gap around supportive housing, either for those who are living with physical disabilities, mental disabilities, and so on and so forth. We know that the need is great, and I would agree with you as a resident that it's frustrating to see inside of a pandemic during a housing crisis that has been exacerbated, and as well as seeing some funds trickle down to meet the needs of the healthcare system in order to provide those supports. There's definitely a gap there, so happy to support the language to come forward to support your advocacy as a resident here in Hamilton and lift the voice up to the provincial level so that we can hopefully see some additional funding come through and get the adequate supports that our community and every community across Ontario needs right now to meet this dire need. Thank you for your advocacy and support.
Thank you.
Thank you. And thank you, Councilor Nan. And Angela, like I say, you have a strong voice, and I'm so glad you spoke to us today. And take care. Thank you.
Thank you very much.
Okay, we're going to move on, and
Madam Chair,
we're going to, yes.
If I could just bring forward a motion, seconded by Councillor Jackson, that first we need to receive the presentation, so maybe we should do that. So I'll move that accordingly.
We're going to do it. Okay, we're going to do it all together. The clerk said so. Clerk, would you like to do the motion first, or? Okay, your motion needs to be first, and then we can,
Okay, fair. Okay, so move on ourselves, seconded by Councillor Jackson, that the content of the presentation be referred to staff and that further communication be pursued with Ms. Pugliese with respect to the items in which we need to advocate to the provincial government accordingly.
okay? So it's second by Councillor Jackson, and we will vote on that. But first, and then we'll receive the delegation, right?
Yes.
Okay, all right. So just a second, and we'll do a e-vote on your motion. And of course, that carries. All right. So we're going to move on now to 8.2 and delegation. And I would like to call upon Robert Scott Eames, respecting update on programs on affordable low-cost housing program. Scott, please turn your camera and unmute your microphone. You have 5 minutes. Thank you. And there you are, Scott. Thank you. Go ahead.
Thank you, Madam Chair. First of all, I wanted to thank this committee for this opportunity, and specifically Bruce McLean, Liz Oddie, and Kirsten Maxwell for their active support. I also want to mention and acknowledge that although I'm not asking for financial or in-kind support today, some aspects of the proposals I've brought forward will require that kind of support. After the last meeting, Bruce McLean met with me at length and asked city staff to look for suitable city lots to support the low-rise, low-cost residential solution. City Hall staff was unable to find any lots. As a result, we sent to Bruce that three-phase proposal that you've got a copy of. And here's our status. On the first item, we're actively seeking to place tenants in the Binkley Road property. And we have, the Binkley Road property. And we are talking with Good Shepherd to try to facilitate that. On the second proposal, I've been talking with Liz Oddie with regard to her renovation program that she administers, and she is looking into a potential rezoning to facilitate that going ahead. Both Proposal 1 and Proposal 2 will each accommodate about 30 tenants. Proposal 1 is available for immediate occupancy. The third proposal is, of course, the new construction. And I wanted to say I was heartened by Kirsten Maxwell's response to this proposal. And I quote, "I am excited about the possibilities of your alternative. A lower cost model would be a huge step forward." Thank you, Kirsten. Bruce has put me in contact with East Hamilton Kiwanis, and they may have lots available for construction, and I have a call outstanding to them. He also sent us a pro forma template. I've done a preliminary completion of that. It's been vetted by both Kirsten and by Bruce with their comments, and we're hoping to move forward to a formal pro forma in the next couple of weeks. One thing that comes out of that is that the cost of the in-kind subsidies for this proposed construction is about $30,000 to $35,000 per unit, which is about 10% of the cost of the other proposals. And so we think there's real legs on this, and there's many possibilities that we're pursuing. However, the one thing I wanted to suggest to the committee, respectfully, is that the lack of land available is a direct consequence of the way the city handles its large parcels of land. The citizens have reacted strongly to the large developments and high towers that are put on large lots of land. I'd like to suggest that the committee consider seriously severing off residential size lots from these much larger plots of land to facilitate low-rise, what I would call gentle densification And that could be either for affordable housing or simply well-priced rental housing. And I think this would relieve the anxiety that a lot of neighborhoods face when they see large towers going in right adjacent to single-family homes. So we're pursuing this, but I think the committee should seriously consider discussing the idea of severing residential size lots to support gentle densification. Thank you very much.
Thank you, Scott. And do we have any questions from, I see none. Okay. Thank you for your presentation today. And we'll move on. Thank you.
Thank you.
Thank you. Okay, the next one is 8.3. I would like to call upon Francis Lau, who will be joined by Mary Boulas and Stephanie Lee, respecting an update committee on progress on affordable low-cost housing program. Francis, Mary, and Stephanie, please turn your camera and unmute your microphone, and you have 5 minutes. Thank you. I see Mary. Okay. Mary and Francis, there you are.
Hello.
Go ahead.
All right. Good afternoon, and thank you, everyone, for allowing us to speak today at the American Captives Committee. My name is Francis Lau, and I'm joined by Mary Boulos and Stephanie Lee. We're here representing McMaster Medicine's Day of Action Committee, and we're excited to be speaking with you all today on addressing accessibility and safety issues for Hamiltonians experiencing homelessness. These asks we propose to you all today were not made alone. They were made in detailed research and collaboration with community organizations, public health residents, and even with meetings with many of you counselors before us. I'm going to pass it over to Mary now.
Thank you, Francis. So as we all know, when the pandemic began, all of us were told, wash your hands and stay home so that you can stay safe. Now imagine hearing that the only way to stay safe are those mechanisms and you don't have access to that. That was the reality for our neighbors experiencing homelessness. In shelters, densely populated settings didn't facilitate social distancing. There was limited access to hygiene to prevent the spread of COVID. And these are folks who already have many medical conditions and have barriers to accessing healthcare, which were exacerbated by the pandemic. In particular, when we think of the importance of hygiene and washing our hands during the pandemic, we saw that there was limited access to services and facilities that would normally facilitate that for people experiencing homelessness, including community centers and libraries, which made it extremely challenging to protect against COVID, as well as the elements as it gets colder. The United Nations put out a statement saying that public hygiene facilities were an essential service during the pandemic, and jurisdictions in Canada, such as British Columbia, adhered to that and made new policies and facilities. So we strongly believe that bathrooms are an essential service that will help mitigate the spread of COVID-19 and provide a human right to Hamiltonians all over.
Now, building off of Mary's point, without public hygiene facilities, people experiencing homelessness are often forced to urinate and defecate in public. However, in doing so, they're fined according to the public nuisance bylaw. And of course, folks experiencing homelessness often cannot pay these fines. And fining people for public urination defecation is not getting to the root of the problem. We believe that this also contributes to hours of wasted police and bylaw officer work. And overall, we see that the public nuisance bylaw is overly punitive for behaviors that are really only happening in response to insufficient public hygiene facilities that Mary previously outlined. Next slide, please. And lastly, we'd like to bring your attention to the fact that overdose deaths have more than doubled in Hamilton over the course of the pandemic. So this is due to several reasons, one being that people are now increasingly using drugs in isolation because of social distancing measures. Secondly, there's been a lack of access to supplies like naloxone and safe injection, safe consumption facilities. And thirdly, and also our focus for today, is that shelters do not allow for the use of drugs, and this encourages concealed use, leading to overdoses and also prevents people from seeking shelter. Of note, there is huge variability in the drug use policies between shelters. Many places don't even allow for drug possession or possession of drug paraphernalia, so this is hugely deterring for folks who need to seek shelter. What we'd like to see is a standardization of policies across shelters around drug use and to equip shelters with harm reduction supplies so that people can use drugs more safely. And these changes are really essential to ensure that folks who are using drugs are not discriminated against and are able to seek shelter in these coming winter months. So based on these issues, we have 3 asks that we'd like to present today. The first one is a motion to direct city staff to review the mechanisms and best practices to implement 4 seasons and permanent washrooms in Hamilton. And in the meantime, to review locations that could benefit from temporary solutions like porta potties and to estimate costs. Secondly, is a motion to direct bylaw officers to cease the enforcement of the public nuisance bylaw for folks experiencing homelessness. Again, this is not getting at the root of the issue, and we believe it's wasting the time of officers. And lastly, is to increase harm reduction services and standardize policies between shelters. And this is, again, to ensure folks who are using drugs are able to be sheltered during these coming winter months. We thank you so much for your time, and if you have any questions, we're happy to take those.
All right. Thank you for your presentation. Is there any question for Francis, Mary, or Stephanie? All right, we do. And first one is Councillor Nan. Councillor Nan.
Thank you. Through the chair, thank you to Stephanie, Mary, and Francis for coming in this morning and delegating, and also for connecting with several councillors prior to today's committee meeting as well. And just want to say that I do appreciate how much the medical community across the country has been advocating lately and during this pandemic to ensure that our health protocols are at the highest possible standard and advocating for additional funding where needed in order to bridge the gap that this pandemic has exposed. So I appreciate those of you who are in the medical field and medical students coming into the field, coming forward with advocacy as well. I think it's a telling time, telling sign of our times when the medical community is advocating. That said, I did have a couple of questions related to the presentation, if I may, through you, Chair. Your asks 1, 2, and 3. 1 is focusing on identifying best practices to implement access to permanent hygiene facilities and public washrooms. Are you familiar with what occurred or what the hinders, the blocks, what prevented the municipality from putting the porta potties in place that we did previously during the pandemic?
Yeah, so we know that some of the prior issues with public hygiene facilities have been, first of all, many instances of vandalism and destruction, unfortunately. And then with the porta potties during the pandemic, that they had become unsafe and they weren't well maintained. And many times there were needles or other things that were unsafe for our community. However, we know that in other jurisdictions, these public hygiene facilities have been successfully implemented permanently. So we believe that by directing city staff to research the best practices of how this was implemented in other jurisdictions, we can ensure that we prevent those issues from happening in our community.
Thank you for that. And through the chair, just a quick question to follow up. Any thoughts from you regarding our current permanent infrastructure? So some of our parks do have bathroom facilities. Unfortunately, we have to often close them during the winter months because not all of them are winterized. And then there's also the indoor recreation facilities and all of the other properties that the city and municipality specifically currently runs between City Hall and our rec centers. Have you all had a chance to kind of review or look at that and see, instead of potentially investing in porta potties, the ability of the municipality to ensure public hygiene facilities and access through the existing infrastructure?
Yeah, we're happy. So ideally for us, we believe porta potties would only be a temporary measure. For us, the long-term goal is that we need permanent infrastructure that would be winterized and be able to withstand all 4 seasons. So that's why we're hoping that city staff, if the infrastructure allows, to use the City Hall, community centers, et cetera, and keep them open throughout the year and in the nighttime, where a lot of people experiencing homelessness will need to use these facilities. We would be happy to use the existing infrastructure as well, if that's the recommendation of city staff. But we know that these facilities are also important, not just for folks experiencing homelessness, but people with disabilities, people who are pregnant, elderly folks. So we feel that this will be hugely beneficial to our entire Hamilton community, and also encourage people to visit local businesses and be able to be out and about,
I appreciate
as well as
it.
our parks.
Thank you. Mindful of my time, Councillor Pauls, by all means, let me know if my 5
All right.
minutes are if I'm approaching. I
Go
did
ahead.
have one more question.
Go ahead.
Thank you. So in your recommendation under number 2 through the chair to all 3 of you delegating this morning or this afternoon, so the nuisance bylaw and the, I guess the practice of, well, I guess that's not a practice. How do we avoid criminalizing those who are homeless versus how do we ensure public hygiene practices are in place? And if you could just share a little bit more there. As you can appreciate, I'm sure that there are residents in our community who've had to contend with public defecation and urination in their communities and in their neighborhoods, and they're quite concerned about it from a public health perspective. So as medical students, how do you think we could contend with the concern that residents have of public urination versus the enforcement of our bylaw? And then I guess it speaks back to number 1 for you. But if you could please provide some comments from your opinion as medical students about what we can say to those residents who feel very strongly that this bylaw keeps their neighborhoods clean and safe, especially during a pandemic.
I can speak to that. So like you mentioned, I think it really does tie back to ask number 1. So if people aren't able to find a place where they can defecate and urinate in a public hygiene facility, then their only resort is to do it in public on the streets. We see sort of like an inherent contradiction in criminalizing that, and also not providing people with the resources they need to be able to do these things in private, which I think everybody would really prefer. So because those two asks are so closely tied together, we really think that ask number 1 will help alleviate some of the issues that you brought up with ask number 2.
Thank you. And then finally, in terms of the request under the 3rd motion, through the chair to the delegation, in fact, I just responded to an email of a Ward 3 resident who had to use 3 naloxone kits, I believe, in order to revive an individual that they encountered at their workplace. And one of the comments that resident shared with me is it would be super incredible and important that during this pandemic, we provide more wider access to the naloxone kits, given the stat that you presented earlier in your delegation that during this pandemic that in Hamilton, we're seeing overdose deaths doubling during this pandemic versus our stats that were already at a crisis point and that this council has acknowledged as being at a crisis point previous to the pandemic. How would you see the distribution of naloxone kits be facilitated? Like, what's your idea there in terms of do you only want to see it go through our shelter systems, or do you have any other ideas as medical students in terms of how we as a community can work with our community partners or as a city ourselves provide wider access to naloxone kits?
So we know that prior to the pandemic, they were mainly distributed through pharmacies. And I think that the access to pharmacies diminished at the beginning of the pandemic. And as a result, a lot of pharmacies ended up shuttling their naloxone kits to local clinics that work closely with the homeless population. That was something that was found to be pretty effective. So I think that is something that could continue throughout the rest of the pandemic and afterwards. It's really about bringing the naloxone to the spaces where folks who need them are able to access them. So shelters being one important example of that, and clinics that serve these populations as well. Those are just some of the examples off the top of my head.
Thank you. I appreciate you all coming in this afternoon. To the chair, I guess the question I have is, there's a lot of detail and specificity that we would need to explore as a committee in order to assess whether these motions could be brought forward. And I feel like there's a number of questions that these motions then require us to ask of staff. Would you, Chair, want me to come back at another time to ask those questions of our staff, or to do it
Well,
within the delegation?
I think we should do it right now through the delegation while they're there. You could go and ask the staff.
I appreciate it. Thank you.
Yep.
So if I may, through you to our staff, and if we could get the presentation, I guess maybe keep the motion up while staff are preparing to respond. In terms of ask number one, if staff could respond to the direction that's sought here versus what we're currently doing, and what staff, I'm sorry to do this on the fly, but what staff's thoughts might be for direction moving forward.
Thank you. Through the chair, it's Edward John, Director of Housing Services. So in terms of the response to the council and to the information put forward, certainly we've had some experience of this through the pandemic. We have obviously recognized the pressures for access to hygiene services as individual businesses and public areas were shut down. So we have some fairly good experience and understanding of what best to do that. And so I do want to draw attention to the significant investments that were made to our drop-in services and the expansion that we've done to our shelter services to ensure that we accommodate as best we can. First and foremost, those interventions and those additional fundings, which typically haven't happened through council and through the city, have allowed us to coordinate the availability and access for much longer durations of time. So we're almost at a 24/7 ability for individuals to access. We also had the experience with the porta potties outside of First Ontario before we got to this point. And through that process, it was recognized that porta potties alone without significant cleaning, security, and oversight pose financial issues as well as logistical issues. And they were issues to the point where we weren't able to achieve success. Instead, where we found greater applicability was through support of our community partners and through some of the funding that we received both provincially and federally. We've been able to support those communities, agencies such as churches, as well as some more informal drop-in options which have provided those services. I do once again want to address this idea of overcrowding in shelter systems and certainly put clear that through the process early on with advice from public health, we ensured that the physical distancing and layout of those physical plants were conducive to ensure no transmission as best as possible in compliance with those public health measures. So I do want to put that out there and once again recognize the significant investments from city and council on that piece.
Thank you. Through the chair to Director Edward John. So the 24 access support for personal hygiene has come in the form of the city supporting our community partners, some churches, as well as identifying other drop-in locations where those who need access to public hygiene facilities. Do we have a sense of where those facilities are for each ward?
Through the chair to the council.
Thank
Through
you.
the chair to the council, yeah, we continue to provide, certainly with our outreach staff, up-to-date information on where those available access points are, so they can communicate them when they are engaging with those unsheltered individuals on a case-by-case basis. So they are available, and we can certainly share that information. I believe we update on our website as well.
Sorry, thank you. Through the chair, the information is available on the website as well, on the city's website.
The chair to the council, yes, we have that information available, and we sporadically go up and update it. We do have those opening hours and the services provided, and once again, we moved away from the porta potties once again because there's an ability to provide services beyond just those of hygiene at that interaction point. So when we do have those drop-ins, there are a number of other services which assist both in terms of the individual needs, but also the long-term housing needs.
Thank you. And then any comments through you on aspects number 2 and 3 on the motion through staff, to staff?
Thank you. And through the chair to the councillor, I certainly know that the bylaw officers were using utmost discretion when it came to the enforcement of those public nuisance bylaw. I don't believe we actually set any fines for homeless or unsheltered individuals through that time. It was a significant public concern, the defecation in public and other items which were deemed to be unsuitable antisocial behavior. we dealt with that through that communication and engagement, and continue to operate with our local and community partners to educate, to assist, and to provide guidance when it comes to that. We recognize that we are going to continue to have a number of unsheltered individuals, particularly through the pandemic, which is a source of concern, and there's pressures in the system. But we have had a number of successes in engaging individuals and groups when it comes to expectations and what we can do to resolve some of those issues.
I appreciate it. Through you, Chair, back to staff. With winter approaching, I guess there is a lot of concern about how we are preparing to broach the winter and address some of the aspects that are in this motion. So if a seconder is available, I would like to lift this portion of the delegation and put forward a motion that does cover off these 3 points, recognizing staff's comments about the temporary porta potty situation being feasibly likely not an option for us, and that staff have been putting in a lot of resources and attention and working with many partners to identify permanent 24-hour access to public hygiene facilities. I acknowledge that, so perhaps an amendment to what's being proposed by the delegates here for motion 1 being an emphasis on the first portion versus the secondary portion. I would be prepared to do that if I could get a seconder. Thank you.
Okay, thank you, Councillor Nan. Can you take the chair for me?
Absolutely, the floor is yours, Councillor.
I don't know if Mary or Francis or Stephanie, whoever wants to answer, but you mentioned something on your third ask, harm reduction in shelters. Are you proposing that our shelters have the harm reduction facility, or can you explain that to me?
Sure. So one of the problems we've been noticing is that individuals who use drugs are unable to access shelters or must put away their drugs in order to access the shelters. But often this puts these individuals in a form of isolation where they're unable to get the services that they need. So stuff like harm reduction within the shelters would allow people either to use drugs in a safe area within the shelter, or to have easy access to a place to do that. So it's rather not trying to, I guess, discriminate against people that use drugs for going into a shelter, but rather to create a space for them in order to use drugs and prevent things like overdose-related deaths.
Yeah, because
okay, go ahead. Sorry.
Oh, sorry, Councillor Pauls. I was just going to say, because another issue that we've been hearing from patients that our colleagues are working with is that they don't want to enter the shelter system because they know that their drugs or drug paraphernalia will be taken away, which is a significant cost to them. So ultimately, it's just making sure that the shelter policies are a bit more inclusive. We know that some shelters are already a bit more inclusive, and we know that shelters are stretched very thin and are doing way beyond their means with the resources that they have. But we think that this, especially with the winter coming, is going to be essential, that people who use drugs are able to access shelters and aren't turned away because of having those items in their possession.
Also, I'm just wondering, did you do a study, not only the harm reduction, you're saying, we have to provide them with clean needles and with everything else that they need. Have you looked how we could work together, how to help them get out of drugs as well? Or have you looked into that in the medical field? Do you know what I'm saying?
Oh, from a medical perspective, like what treatment programs would work?
Yes.
So, yeah, we know that last year, actually, our colleagues came and we put forward a motion that your colleagues at the Board of Health, or I suppose that's all of you because you're all on the Board of Health, to ask the provincial government to import diacetylmorphine, which is a pharmaceutical heroin that's been shown in British Columbia and other jurisdictions to be very effective for the cessation of opioid use disorder. As well, we know other treatments that are long-term, like Suboxone and methadone, are also effective. So making sure that people in shelters have access to those treatments. Of course, there are a lot of physicians who are already supplying those resources within the shelters and doing outreach, but we think that ensuring that all the shelters, again, some of the shelters already do this. So that's why in our motion, we want to just do more of an environmental scan to see where are the gaps in each shelter, but making sure that there's access to counselors, that there's access to naloxone, there's access to those long-term opioid therapies. Those are the kinds of things we think it has to be a more broad approach. And one of the first steps is ensuring those individuals can access the shelter in the first place. And then once they're in the shelter, do they have the resources so that they can either use a harm reduction approach where they're limiting their use and they're using drugs safely, or if their choice is to stop using drugs, that they have the tools to do that within the shelter system.
Thank you very much. The last question I wanted to ask, you mentioned about bylaw penalties. I was so glad the manager, Edward John, said that really we did not give any bylaw penalties. And I was glad that, so when you did your research, did you find that you were hearing that we were giving tickets, criminalize them? What did you hear that you would put that in a motion?
Can you repeat that, Councillor
Okay.
Pearl?
I'm just saying that your second request was bylaw penalties. And I'm wondering, I was so happy the manager, Edward John, said that we have not given any penalties. We have not criminalized them. We have treated them with respect. Where did you hear? Why would you bring up the penalties? Have you heard from the community or from people that we have given penalties? Because we know they can't pay for them. So where did you hear that? And why would you ask for that motion?
Right. We've heard from physicians that work with these populations that people experiencing homelessness have been ticketed for upwards of $880 for either being in park spaces, being in large groups, or public urination defecation. So things along the lines of the public nuisance bylaw is what we've heard.
And that's what you heard. So Manager Edward John, are you there?
Yes, I am.
Can I ask you a question? Have we given tickets of up to $800, did you say, for bylaw penalties?
So through the chair to the council, we can report back. My understanding, and we work very closely with Bylaw, that throughout the pandemic, they have been very tolerant of this situation and have been working on the engage first. We'll confirm exactly. My understanding is that there have been none, but I'm happy to bring back to this committee any instances. And I say that during the pandemic, historically, obviously there have been occasions where fines have been put in place, but through the pandemic, certainly from early on in the pandemic, there has been an obvious recognition of the circumstances and the applicability of those bylaws accordingly put in place. So I'd report back because I can't speak on behalf of Planning, Economic Development and Bylaw, but we can certainly report back.
We would like to know, it's because the pandemic now it's been 8 months, so we need to know if this is happening. Thank you very much, and I'll take the chair back. Thank you, Councillor Nan. Is there any other questions? Councillor Jackson.
Thanks, Madam Chair. And first of all, thank you to the medical students, Francis and Stephanie and Mary, for appearing. As a former graduate of McMaster University, I wish you, not in the medical field, but I wish you all the very best in your studies and your future careers and appreciate your advocacy. Since, Madam Chair, you've allowed some latitude here, I just don't want to simply receive the three-part motion here from these medical students and their day of action advocacy, but I just have some caution, and I appreciate Councillor Nam putting the motion to explore all three on the table. However, I would want all three to eventually report back to ECS committee. It only says that in motion 1. I would want motion 2 and motion 3 to also stipulate that the staff would eventually report back to ECS committee on their findings. Also, in each of the motions, I'd like to offer a slight amendment. On motion 1, I would suggest amending it to say motion to direct city staff to review the feasibility of mechanisms and best practices for permanent washrooms. Motion 2, I would say I would like to offer this amendment, that motion to direct bylaw officers to review the upside and downside of ceasing the enforcement of the public nuisance bylaw. And under 3, I would like to amend to say motion to direct city staff to identify discrepancies in harm reduction services and policies between shelters to review the feasibility of standardizing them between shelters and those who use drugs. I would offer those amendments, Madam Chair, and with all of that reporting back to committee, because I need to understand better the pros and cons of what these students have brought forward. I very much respect the thrust, Madam Chair, of all the work they have done, their findings, and their advocacy. But I also need to understand if there's consequences potentially to going in any of these directions without hearing from professional staff. Thank you, Madam Chair. I offer those amendments if the mover of the motion would be open-minded to at least consider them. Thank you, Madam Chair.
Counselor, that's very wise because we need to know from staff. And I also want to thank Francis, Mary, and Stephanie for coming. I met with the students myself, and we had a good conversation about this. So I really appreciate you coming to speak. So, Counselor Nan, would you accept the amendment that Counselor Jackson put on the floor?
Most certainly, and I appreciate the opportunity to pause and just look at that, because that was my concern in looking at those motions and the delegation's request versus our obligation as committee members working with our staff to take the advocacy but put it in a format that enables our staff to bring back the information and have all of council eventually receive the information as it relates to our homelessness strategy moving forward and how we may improve that. So absolutely, wholeheartedly accept those amendments, and happy to have this move forward. Thank you.
Thank you, Councilor. So, first of all, let me have a mover and a second to receive the delegation. Oh, I'm sorry. There's more speakers. Okay, Councilor Marula for the first time.
Thank you, Madam Chair. I just want to say that I fully support what's before us. But I guess like anything else, once we see the review and we see the feasibility, I think the biggest obstacle we're going to encounter are obviously dollars. So the issue for me is trying to identify if once the feasibility review comes back, how are we going to pay for it? This would, I think, in many ways, fit into the $50 million allocation for poverty initiatives, which I think this is a project that I think would fit that criteria. So I'm going to throw it out there as an option for staff when they review this as the feasibility of this, to come back and identify that as a potential source to pay for it. And I want to thank everyone that's involved in the presentations. And I also want to apologize because I've been meaning to reach out. They did reach out to me to talk to me about this, and I didn't get back to them in a very rare moment, but I apologize that I didn't. But I strongly, as a former addictions counselor, it would be remiss of me not to support what's before me. And I'm really impressed with the work that you've done. I congratulate your efforts, and I think it's a great initiative. Now we just got to pay for it. Thank you.
Thank you. So we're going to, is this a direction for staff or do we need to put a motion? The clerk? Okay. So why don't we just put it a direction to staff to look at it? Oh, Councillor Nan, you want a motion?
If I may, through the chair, I really appreciate the opportunity to ask this question and seek the clarity. So I did put it forward in the form of a motion. I did hear the sage intervention and support from my colleague, Councillor Jackson. We just discussed putting it forward with those amendments. So I would be prepared to keep it going in the form of a motion and move it along. So
all right.
Unless as a chair, there's other direction that I'm not clear about. My understanding is that if we're informing staff to do something, that we do it in the form of a motion. But if there's another colleague who wants to intervene and provide a different perspective, that might be helpful. But I do prefer it to come forward as a motion if I can, please.
Okay. All right. Thank you. Councillor Marula, do you have a suggestion we could do? Councillor Marula?
Yes, just quickly, can you hear me?
Yes, I can.
Okay. We need to clarify one thing as well, because I think from a public perspective and the messaging and all of this, any of these initiatives are going to help universally. So when it comes to public washrooms for Four Seasons, I can assure you that there is significant support in this city for that. So it would be remiss of us not to emphasize that this is a universal initiative. Number one is, and I needed to say that. Thank you. And with respect to the motion, all we need to do is wrap all of this collectively together and direct it to staff to look at the feasibility and report back. And I think that's the motion itself. So I look forward to supporting it. Thank you.
Okay, thank you. So we'll put it as a motion for the staff to look at it and to report back. Is that good? Councillor Nan?
Yeah, so a motion to direct staff to review the items presented in this delegation, report back with the appropriate, at the next appropriate Emergency Community Services Committee meeting with the feasibility of addressing the items identified.
Okay.
Fine.
And
Thank
Councillor okay, and Councillor Jackson seconds it, and we will vote on that. Evo, please. Thank you again, Mary and Stephanie and Francis.
Thank you for having us, councilors.
Thank you so much.
Okay, and that carries. So I need a mover and a second to receive all the delegation. Evo. Does Councilor Marura want to speak? No? Okay. Your name's up there, Councilor Marula, so I don't know. Okay, let's vote on the delegation. The seconder, Councilor Marula. The mover, Councilor Jackson. Okay, this is to receive the delegation, okay? Okay, thank you. We're going to go to 10.1, reduction investment plan update. May I please have a mover and a seconder to put the report to the floor? Councillor Nan and Councillor Jackson, thank you. Is there any discussion on item 10.1? I see none. We're going to go Ebo, please. Thank you, and it was carried. We're going to move on to 10.2. I need a mover and a seconder, Councillor Nan and Marula. Thank you. Is 2020 arena opening plan. Is there any discussion on this motion and this item? Councillor Jackson.
Thank you, Madam Chair. Obviously, this is extremely timely, and whoever is possibly, I know General Manager Johnson said he may have to duck out. I don't know if he's back, or Director of Recreation, Chris Hurstick. I think this is very timely in light of, again, I'll speak very bluntly and honestly, Hamilton being now in the red category, unfortunately, how it may restrict the usage of our many arenas and rec centers. So maybe a comment from either Director Hurstick or General Manager Johnson, Madam Chair, through you, please.
Thank you. Is there we go. Manager Chris Hurstick.
Through you, Madam Chair. Absolutely correct, Councillor. We wrote this report prior to the City of Hamilton moving into the red category of the provincial guidelines. This is our third installment of an update of our arena opening plan. We've been working with the user groups, and as demand for ice increases, we've been opening up additional arenas. This was to highlight that we had additional demand, and we were opening up Carlisle Arena for November 30th. And also we had additional indoor demand for volleyball and basketball, and we're opening up Beverly Arena and Coronation to help support that. Obviously, with going into the red category, starting today, our indoor limits in the arenas are reduced to 10, and that is for rinks, but it is also for every facility. So the combination of 10 per facility. So it is a hardship and a challenge for not only us, but the user groups, because at a twin pad arena, we only can use one pad because we have to adhere to the 10 indoor limits. And that's for coaches and players is the 10.
So, Madam Chair, thank you, Director Hurstick. Keep your microphone live and active here, please, because this is a hot topic right now across our community. And I know, Madam Chair, you have received quite a lion's share of people because of your work with athletic groups and that. So, Chris, subsequent. So are you telling me now with the red category, whether it's a quad pad arena of 4 pads inside the one big building, or it would be a simple single pad at Lawfield, are you telling me both under the red category, the Ford government are treated the same, only 10 people at a time? Through you, Madam Chair?
Through you, Madam Chair, that is correct. A facility, no matter what the size, the indoor limit is 10.
Oh my goodness. Okay, something seems wrong with that picture. Chris, I also see in your report the district school boards, public and Catholic, have either closed down or reduced the availability of their gyms. Is that putting greater pressure upon the municipal facilities, Madam Chair, through you?
Through you, Madam Chair, that is correct. We were notified in late August, early September that their gyms would not be available for our use as well, for our recreation programming, due to the increased need for spacing students. So their gyms were used as teaching spaces. That will be up for review come January. But that also affected the local youth basketball and volleyball groups that wanted to rent their gyms, or normally would rent their gyms. They just were not available to them.
So you're doing your best to accommodate them, even though you've got a cap of 10 per facility over the within the red category. Chris, through you, Madam Chair.
Through you, Madam Chair, before today, we were at the 25 per rink, so we were able to have some basketball practices and volleyball practices. But now with the 10, it will definitely be a hardship for a lot of these groups to participate.
So last question, Madam Chair, I appreciate your indulgence. So Chris, again, the list on your November 19th report that was written prior to Hamilton falling in the red category by the province, all the arenas listed here, though, are still open, but now with reduced capacity. Madam Chair, through you, and that's my last question for now.
Thank you.
Through you, Madam Chair, that is correct. Reduced capacity. Yes. Okay. And as we mentioned before, if it is a twin pad, only one pad is available. The second pad is, in essence, still have ice, but it will be closed because we have to adhere to the 10-person indoor limits.
Madam Chair, in light of this, later on with my motion, I think it's all very timely, but thank you very much for now, Madam Chair.
Thank you. Can I pass the chair to Councillor Nan?
Certainly, the floor is yours.
Thank you. Chris, I got a call. If somebody, we were doing 25, now we're doing 10, and somebody said that the price is going to be the same. Is that true? I know the cost of the rink.
Through you, Madam Chair, correct. Right now, we don't have the authority to reduce what the council-approved user rates are, but I believe Councillor Jackson will be addressing that later in the meeting.
And I had a lot of calls saying that that children are not playing in schools. There's no sports in schools, and parents are trying their hardest to get the kids active, you know, in this hard time. So I think the motion that Councillor Jackson's going to put in, it's a great motion. But I'm really concerned. I'm really concerned that we're limited, and sometimes it doesn't make sense. One of the constituent called me and says, if a rink has 4 doors and has 4 rinks, can they go in different doors, separate themselves? And I said, I didn't know the answer. The answer is only 10 people. Doesn't matter how big the rink is. Doesn't matter how many pads there are. And that's why I think it's frustrating for parents of kids that want to keep their kids healthy, want to keep their kids active, and it's frustrating. And but I want to ask you, this is a 21-day restriction. Am I correct?
Through you, Madam Chair, I believe it's a 20-day restriction and ends close to December 14th or December 14th or 15th.
So, Chris, if it ends and we know that we're not going to be on red, can we easily open up quickly?
Through you, Madam Chair, absolutely. As soon as we get that direction, we already have the ice in there. Staff will make those necessary changes. We will just need direction from the province on how many residents and patrons would be allowed at one time within each facility.
Right. And if we go back, I think it was in the yellow, it would be back to 25. Is that what we have now?
Through you, Madam Chair, that's what our hope would be, that the limits wouldn't change, but it was 25 per arena pad when we were in the yellow category.
Thank you. It is hard times for sure, but I understand the frustration of all the constituents that are calling me, all the people that have kids in any sport. It is frustrating, but we have to work together and make this work. And I can't wait to hear the motion what Councillor Jackson puts in. So thank you. Anyone else? I don't see anyone else. Councillor Jackson, you want to put your motion in? No? Not now? Okay. So we're going to...
I'm at your discretion, Madam Chair. I was waiting under item 11 for motions, but it is part and parcel of this discussion, but I'm at your discretion. Thank you.
I think we should do it now. We're at this motion. We're all excited about this motion, trying to help our constituents and families. So
okay.
I think we should put it on now.
I have concurrence with my colleagues then. I just don't want to supersede previous discussion items. Okay, thank you, Madam Chair. So I did send it. I apologize. It was just overnight that I had discussed this with Recreation Director Chris Herstick. So I sent it electronically, and he helped me with the language and the wording of the motion. So now for public consumption, I'm sorry that it's not actually showing on the digital agenda today, but it's now in the public domain, what I'm going to read, and Elsie Bates will have it for anyone that wishes to access it. Moved by myself, seconded by Ward 4 Councillor Sam Marula. Whereas the City of Hamilton has entered into the red control category of the province's Keeping Ontario Safe and Open framework as of Monday this past week. Whereas the province of Ontario confirmed the new capacity limits for recreation facilities and programming. Whereas the maximum indoor capacity for practice and training in arenas and our rec centers is 10 patrons. And whereas the new indoor capacity limits will create a financial hardship, Madam Chair, for the recreation user groups in sports and fitness activities of hockey, ringette, figure skating, speed skating, sledge hockey, basketball, volleyball, therefore be resolved that staff be directed to reduce current fees to half of the council approved user rates retroactive to November 16th, just this past Monday, for all affiliated ice and gym user groups for as long as the City of Hamilton is within the red control category of the province's Keeping Ontario Safe and Opening framework, and that staff report back to committee during the 2021 city operating budget process with the potential impact this may have on the department's revenue. Moved by myself, seconded by Ward 4 Councillor Sam Marula. Madam Chair, just real quickly, as you stated, the health of our community overall is absolutely paramount. But having said that as well, again, I'm just still miffed, puzzled, and peeved by how Hamilton got lumped in with York, Toronto, and Peel. It's done. We have to wait it out. But in the meantime, so many of our user groups are having not only in terms of attendance and the number of families and kids that want to recreate and be active, but now that's curtailed, that's restricted, and it's also impacting a lot of our volunteer groups, funds, and financial situations. And so, Madam Chair, I would also say, whatever impact, if this is approved today by committee and ultimately ratified by council, whatever impact this might have, we received $45 million from the province for COVID-related costs for 2020 budget. Depending on how long this may go, General Manager Zagaric said he's constantly reviewing the situation and possibly will even put in an ask for 2021 COVID-related costs, which this recreation reduced half fees could easily, in my opinion, be defensible and could be rationalized to support. Thank you, Madam Chair. Seconded by Councillor Marula. Thank you.
And thank you, Councillor Jackson. I wanted to second it. It's such an important to me when I receive calls that parents want their kids to be active, and it's really hard at this time. So thank you for putting that, and thank you, Sam Morella, for seconding it. So we're going to vote on that motion. And it passes. Who has it? Oh, Councillor Marula, can you vote? Did he vote? Councillor Marula, can you vote? Can you vote? Did he vote? Okay, thank you. Thank you. Okay, we're going to move on now to 10.4. Federal Reaching Home Funding allocation. May I please have a mover and a seconder to put the report on the floor? Can I have Councillor Nan and Councillor Marula? Thank you. Is there any question? Is there any discussion on this event item? Is there any? Councillor Nan, your name wasn't up, so sorry. Well, it's not. Okay, Councillor Nan.
I swear, toggling between all the screens today, I am having a hard time. I apologize, Chair, for not indicating quickly enough. I'm not sure what's going on here, but thank you. On item 10.4, reaching for home funding allocations, the recommendation is that we go into agreements with community service providers regarding the total amount that's available. And I apologize as I haven't had a chance to go through the report in detail. Is there any information that staff can state publicly in terms of the community service providers that would be entering into agreements for, or is this still in the works? Through you.
So it's a total, okay.
Thank you. And this is Edward John, Director of Housing Services. Through the chair to the councillor. So this funding obviously is an enhancement to what we received early in the pandemic. We made a number of commitments through that time, which this funding would be eligible for. So we're still in those discussions with community providers in terms of what we will use the full balance of those funds for. So some of it is prior commitments, but we do have a portion of that which we can allocate to either projects or assistance in that homelessness strategy prevention approach. So that's essentially the options that we have, and also we have a time limit to that to use by end of fiscal, which is end of March next year.
Thank you. So through you, Chair, to the Director, then we are going to try and gap meet any existing projects that we're working on as a city, as a partner, and that if there are any, we're also exploring additional projects that can be implemented within the time frame. Correct?
Through the chair to the council, that's correct. The Reaching Home Fund also provides the ability for capital funding, which often isn't usually available through these types of funding pots. So we are looking to do that. And as I'm sure this committee is aware, we do have the Rapid Housing Initiative. So there is an option to stack programs too. So if we see a particularly attractive development, we can look to stack that with Reaching Home dollars, provided we can spend it in that allotted time. So we are looking at a range of opportunities with this funding, and we'll report back as we do, as always, in terms of what those allocations went to.
Excellent. Thank you.
Thank you. And anyone else? I don't see any. Okay, so let's have Ivo. And it's coming up now. Oh. Council Marula, did he vote? What's that? Okay, it's good. Okay, thank you. We're going to move on to 10.5, paramedic service updates. May I please have a mover and a seconder to put the report on the floor? Councillor Jackson and Councillor Marula, thank you. At this time, I would like to call upon Chief Michael Sanderson to introduce this item. Chief Sanderson, please turn on your microphone and camera. There you are. You look lovely. Thank you.
Thank you very much. It's Mike Sanderson. I'm Chief of the Hamilton Paramedic Service. Madam Chair, members of the committee, thank you for the opportunity to provide this information update. It has been a while since I provided an update, and with all of the activities underway, I thought it would be important to update the committee and the council on, first of all, what we're dealing or how we're dealing with the pandemic and the effects of the pandemic. And secondly, to assure council that we're continuing to move forward on all of the normal business activities, including the quality, the development, the innovation, mandatory education required to maintain certification. So I've tried in this report to flag the issues around our operational activity, including what our responses are like and how they've changed, the number of COVID patients or suspect COVID patients that we're dealing with, what our staffing has been like and some of the challenges we've been doing in maintaining our staffing and the activities. What our COVID self-isolation activities have done and how that's impacted our staff, what our personal protective equipment has been and the successes we've had in managing that activity with the support of the ELC, some of our innovation activities, and of course, some of the funding issues that are around the cost of dealing with some of the COVID. And finally, in the normal business realm, and it's not included in this report, I just wanted to quickly mention that I was so very pleased today to attend a reunion event in Freelton. It was this morning. One of our patients and his family wanted to thank two of our paramedics, Nadine Valdez and Matt Downs. The patient had a heart attack a few weeks ago. His heart had stopped. He was resuscitated by our paramedics on the scene. He was then transported to the Hamilton General Cath Lab. And it was teamwork of all levels, including the Cath Lab, some of the planning, the activities, and the preparation. It's all those teamworks and all those activities in terms of our normal day-to-day operations that contributed to a successful outcome. And it just made me feel so proud this morning when I was there with our paramedics about what our paramedics do and what impact that has on the community. So congratulations to them in terms of their activities.
Wow, thank you. Excellent, thank you. Is there any questions? I see none. You must be doing a great job. We have no questions to ask. Thank you. All right, so we're going to have a Ivo to accept the presentation. Thank you.
Through the chair, would it be okay for me to break total protocol and make just a brief statement about our chief?
Definitely. You could break any protocol here.
I just want to let our committee know, and when you read that report and you see just how we've gone through the pandemic and continue to work, you know the skill and how lucky we are to have our chief here. I also want you to know I had the pleasure at one of his recent leadership meetings of presenting him with his 45-year pin of work in paramedic services. So he has had a tremendous career and continues to provide great leadership here. We're going to take credit for all 45 of those years, even though he hasn't worked for us that long. But I just want to say how proud I am of our paramedic chief.
Yes, we all are. Thank you very much, Paul Johnson, and thank you again, Michael Saunderson, our chief. Thank you. Okay,
If,
we're going to vote. Yes, go ahead.
if I could, Madam Chair, I would just like to thank the City of Hamilton for the opportunity to lead this team. I've got an excellent team here, and I appreciate all the support from the general manager and from the city. But just the opportunity to lead this team in the City of Hamilton has been tremendous, and I really do appreciate it. Thank you.
Yeah, and as you know, our survey that we've just read yesterday, I think it was yesterday, that you're in the high 90s, that we all appreciate, the City of Hamilton appreciate all what you have done. Thank you. Okay, so let's move on to the vote. Did we voted? Boy, thank you, and it was carried. All right. Okay, 10.6. May I have a mover and a seconder to put the report on the floor and its assets of a Hamilton offers and refusal policy change? Can I have Councillor Marula and Councillor Nan? Thank you. Is there any discussion? I see none. We're going to do an e-vote. Thank you. Well, okay. That's weird. I'm spinning, that's why. Okay. Okay, so we are ready. Motions, it's already done. Motion 11. And we already did the motion. Do we have a, okay. So for general information, other business, is there any other items of general information or other business? Okay, Councillor Nan.
Thank you through the chair. I didn't want to end this meeting today without acknowledging that it's Hunger and Homelessness Awareness Week, and to take an opportunity, I'm sure with the rest of my colleagues around the table for this committee, to acknowledge that everyone in the city right now is struggling to put nutritious food in their mouths and keep appropriate shelter over their heads, and contending with this during a global health pandemic and with winter fast approaching has been something that all of us have been contending with. And I wanted to take a moment just to say thank you from the bottom of my heart, and also as a representative of the City Council, to everybody across the city who's been working in our emergency food systems, who's been working in outreach services, who've been working as community volunteers, who've been working as healthcare workers and doctors, housing service providers, and also our faith-based community as well, in addressing our housing crisis and also addressing the needs of our residents who are going without food to eat. So I just wanted to take a moment to say thank you, and also to those who are finding themselves facing these burdens at these times. Just a reminder to the rest of our residents who may find themselves with a few extra hours a week to volunteer or a few extra dollars in their pockets, that you and your contributions to your neighbors is invaluable at this time, that all of us have a role to play, that every single one of our residents, regardless of the hardships that they're facing, belong to us. Right? We belong to each other in this city. And it just, these times are intense. And yeah, just given the nature of the work that we deal with around this table with all the staff teams that support the work of the city as it relates to emergency services and community support, hunger and homelessness is a lot of the work that happens behind the scenes between these committee meetings on this portfolio. So I just wanted to take a moment to say thank you to everybody and remind everybody to dig a little bit deeper, and let's get through this pandemic and also address these issues together. Thank you.
Thank you, Councillor Nan, for bringing that up. I actually had a meeting with Neighbor to Neighbor this morning for over an hour. We talked of ideas, how to get people to donate, how to help out. And also this weekend, Lime Ridge Mall is doing a drive-through for cars to come by and drop off food for the food chair. So good things are happening. Hamilton is a giving city, really is. I've experienced it when I wasn't in council, when I did fundraisers. Hamilton was always there. People always came to help. So I want to say to Hamiltonians, thank you. Thank you that you're always there helping people. So thank you for bringing that up, Councillor Nan. Okay, we're going to move on. And I think we're almost at the end. Oh, Councillor Jackson, sorry. I'm getting, all
No,
right, Councillor Jackson.
Thanks, Madam Chair. First of all, I wanted to recognize the eloquence of Councillor Nan and bringing the hunger issue to the fore today without this committee adjourning before the topic was raised. And she very eloquently spoke about the need, and even greater with the global pandemic. And Madam Chair, I've known about your volunteer work over the years, raising money for proper water, clean water in Haiti, and even within our own community as well. And Councillor Marula's involvement as well with many, many groups in our community. General Manager Johnson, I would just say, in light of what Councillor Nan introduced, between now and Christmas, we don't know where all of this is going with the pandemic. We have great partners in the community with Food Share, Joanna Santucci, Neighbor to Neighbor, Denise Arkell, and many other organizations, Good Shepherd, Mission Services, Wesley Urban, and others. I would simply ask, General Manager, we support either through manpower, resources, and or through grants and funds, that in this unprecedented time, if you and your staff are aware of those agencies that might need emergency help so that they could feed the hungry between now and Christmas, even with a Christmas meal, I would simply ask you keep it on your radar and bring it to this committee's attention. Thank you, Madam Chair. Appreciate that. Thank you.
And thank you, Councillor Jackson. All right. Page 12, okay. Okay, private and confidential long-term care home incident investigation report. Members of the committee, do you wish to go in closed session? Okay, may I have a mover and a seconder then to receive the report? Councillor Jackson and Councillor Marula. And we will vote then, and then no, they don't want to. So we're just going to vote.
Madam Chair, I'm supportive of it, but I'm already in the in-camera section, so I can't vote.
Do you want to go in closed session?
Yes, yes.
Oh, okay.
I don't need to unless you guys want to.
Well, I just asked. That's I thought everybody.
Oh no, I don't need to. I thought you wanted us.
No, I just asked if anybody wants to go into closed session.
Oh no, I'm fine. I'm fine. Thank you.
Okay, so we will vote then. Councillor Jackson. All right, Councillor Jackson.
Madam Chair, I just wanted to say I've read the report. It's a follow-up to what we had in camera about a month ago, and I'm very satisfied at this stage with what's been reported in camera. So that's why I'm satisfied, and I'm happy to just receive it. Thank you.
Thank you. So we will have Councillor Marula and Councillor Jackson second it, and we'll have a vote, an e-vote on this. Okay. I'm going back and forth today, so that's why it's, I didn't have the second computer. Okay. Did we vote on it? No, okay, it's coming. I usually have two computers. I have one today, so. All right, it's up. Thank you. Okay, so mine's spinning again. Okay, now this is adjourned. Please have a seconder and a mover and a seconder. Councillor Nan, Councillor Jackson, thank you. And we're going to vote. Thank you very much. Have a great weekend. Well, we're going to vote. And if you want to drive through Lime Ridge Mall and drop off some food, it's Saturday and Sunday. Check it out. Thank you. We vote? We have to vote. I think Narinda left already.
So we're good.
We're good? All right. Thank you. Thank you, everyone. Thank you. Thank you.